We now talk to infectious diseases expert, Dr. Rontgene Solante. Good morning, Dr. Solante. Thanks for joining us. Now, Doctor, we saw another all-time high in the number of daily cases. Yesterday, we had 22,820 more cases. Tell us, how alarming is the situation?
Yes, Mai, it's very alarming because we continue to get cases in most hospitals, particularly the severe critical. These are the cases that has been occupying most of our beds, and our capacity has always been full, including the emergency rooms, particularly now in the ICU. So that puts some patients that are not yet in the hospitals may have difficulty of getting into the hospitals. They have to queue long lines. So we would expect more people to really suffer and have severe infection.
Doctor, what is driving this spike in cases, and is it still mainly because of the highly transmissible Delta variant?
Yes, precisely. That's the point. Because if you look at the last surveillance of the Philippine Genome Center, 76% of the total samples randomly tested are already the Delta variant, and this is the what we have been saying. The characteristic of how a Delta variant can transmit: more people, more interactions, less compliant to the health protocol, and we have still a very low vaccination rate. These are all the main reasons why we are having this surge of cases.
Now, Doctor, you're also a member of the vaccine expert panel, and the WHO is appealing to wealthier countries to refrain from giving booster shots, at least for the rest of the year. This is to allow other countries to vaccinate at least 40% of their population. Here at home, are we getting enough supply, and are we vaccinating quickly enough?
I think that's still the limitations of our vaccination rollout because of the limited supply of the vaccine. And yes, we do agree that we need to vaccinate more, particularly those who are unvaccinated. The booster recommendation is only recommended for the selected healthcare workers who are really front lines, taking care as front liner of this COVID referral hospitals. So these are not really a lot, no? And again, the objective really here is to vaccinate everyone as much as possible as soon as we have most of these vaccines available.
At this rate, when do you think will booster shots be allowed in the country? Marami po kasi ang nagtatanong kung kailan sila pwedeng magpa-booster shots, especially the last time I talked to you, sir, was Saturday, and you said the priority for boosters should be for the healthcare sector or for the healthcare workers.
Yung finding namin dito sa booster is at least 6 to 8 months, no? From the time they receive the second dose. Yun yung recommendation natin. Pero ang magde-decide pa rin yan is the Department of Health, and there are factors to consider kung kailangan at maibibigay ba natin yan because of the supply and the other considerations.
But at this rate, Representative Joey Salceda in a forum just said that we aren't getting enough supply. He said, like, we are getting only half of our vaccination capacity daily.
Yeah, so that will be an important factor because if the supply is really limited, and then the booster shots will also be will wait.
All right, thank you so much for your time this morning. Infectious diseases expert, Dr. Rontgene Solante.